In this video, I will discuss about how to lower blood pressure quickly. If your blood pressure is abnormally high, you will need to lower it as quickly as possible. There are ways to do this using nothing but diet and lifestyle. But if you are already facing hypertension, your best bet might be to get your doctor to prescribe medication. Here's what you need to know about the options available to you. I will divide this topic into 3 different methods. First up are lowering blood pressure with diet. Maintain a balanced diet. A diet composed of whole grains, fruits, vegetables and dairy can lower your blood pressure by as much as 14 mmHg, especially when that diet also contains minimal amount of saturated fats and cholesterol. Dietary changes are usually the first step in dropping your blood pressure. The effect may be gradual if you do nothing but more than balance your diet. But if you focus on consuming foods known to drop blood pressure and accompany your diet changes with activity and lifestyle changes, your blood pressure will drop much faster. After you drop your blood pressure to the level it needs to be at, you can indulge in the occasional candy bar or cookie, but you should also strive to follow a diet like this most of the time to prevent your blood pressure from spiking up again. Skip the salt. Sodium is a natural foe of high blood pressure. A small drop in your sodium intake can often lower your blood pressure by 2 to 8 mmHg. Limit your sodium intake to 2300 mg a day or less. If you are older than 51 years of age or if you have underlying conditions causing an increased blood pressure, stick to 1500 mg of the sodium a day at maximum. You should also check food labels on the processed foods, which can contain massive amount of salt. If you need to add flavor to your food, you can do so safely with many herbs and spices. Some herbs and spices in particular can actually help you to decrease your blood pressure. Cayenne pepper expands blood vessels and improves blood flow. Turmeric decreases inflammation in the body overall, thereby improving cardiovascular function and causing a drop in blood pressure. Garlic lowers both cholesterol and blood pressure. Third one is limit or eliminate your intake of alcohol. In small amount, alcohol can actually cause your blood pressure to drop. However, the positive effects of alcohol can disappear after 2 drinks. In higher amount, it can cause your blood pressure to increase. For men and women over the age of 65, drink 1 glass of wine or a beverage with a similar alcoholic content per day. Drink milk. Milk is packed with potassium and calcium, and both nutrients have been linked to low blood pressure. Dairy also contains vitamin D, which may also help. Since whole milk is high in calories, drinking milk may not be a good option for you if you are overweight or obese. Carrying extra body weight can increase your risk of high blood pressure, so it may sabotage your efforts. Talk to your doctor to find out if milk is a good option for you. Fifth one is drink hibiscus tea. Herbal teas containing hibiscus can lower blood pressure quickly and dramatically if you drink 3 cups on a daily basis. Steep the tea for 6 minutes before enjoying it cool or hot. Hibiscus tea contains anthocyanins and other antioxidants that strengthen your blood vessels, preventing them from narrowing and causing your blood pressure to spike. If you are taking a medication to lower cholesterol, such as simvastatin, talk to your doctor before you drink hibiscus tea. 618. Pour a glass of cranberry juice. A glass of low-calorie cranberry juice can lower blood pressure as effectively as a glass of red wine. Cranberry juice contains antioxidants known as proanthocyanidins. These nutrients restrict the body's production of AT1, a compound known to constrict blood vessels and elevate blood pressure. Eat fruits and vegetables that lower blood pressure. While fruits and vegetables are an important part of a balanced diet in general, some have a notably beneficial effect on lowering blood pressure. Eat kiwis. In a study done by an American Heart Association, scientists discovered that eating 3 kiwis a day for up to 8 weeks could dramatically lower systolic blood pressure. Kiwis are rich in an antioxidant known as lutein. Enjoy a slice of watermelon. Watermelon contains fibers, lycopenes, vitamin A, and potassium, all of which have been linked to lower blood pressure. It also contains an amino acid called L-citrulline, L-arginine, which early studies indicate may help lower blood pressure as well. Include a wide variety of potassium-rich fruits and vegetables in your diet. Potassium is a vital addition to any diet designed to lower blood pressure. Good sources of potassium include peas, bananas, potatoes, tomatoes, orange juice, kidney beans. Consider drinking coconut water. Coconut water is high in potassium, electrolytes, and nutrients linked to lower blood pressure. Drinking coconut water can help lower your systolic blood pressure. Consume more tofu and soy products. Soy products contain isoflavones, nutrients that may have a direct link to lower blood pressure. Green tea and peanuts also contain a healthy amount of isoflavones. Indulge in a bit of dark chocolate. Chocolate in general is rich in flavonoids. These nutrients encourage the blood vessels to dilate wider, thereby lowering blood pressure. For the most benefit, read the label to make sure that the chocolate you choose to contains cocoa and is low in sugar. Since chocolate can be high in calories and sugar, eat it in a moderation and fit it into your diet. Otherwise, it may cause unintentional weight gain. Since extra body weight increases your risk of high blood pressure, this can be counterproductive. Consuming chocolate can reduce blood pressure in individuals with high blood pressure, but the results are less pronounced in individuals with normal or near normal blood pressure. Spice things up with chili pepper. Capsaicin, a spicy component of chili peppers, might encourage a drop in blood pressure when consumed. Now let's take a look at the second method, that is living a low BP lifestyle. Set aside 30 minutes for moderate level exercise. Exercises for at least 30 minutes on most days of the week can quickly and substantially drop your blood pressure. Before increasing the amount of exercise you do in a day, you should ask your doctor for guidance. Increasing your physical activity too dramatically can actually put you at a greater risk of heart attack or stroke. Power walking is one of the simplest exercises you can add to your routine. Walking at a brisk pace for 30 minutes can lower your blood pressure by nearly 8 mmHg. Other athletic activities you can try include volleyball, touch football, shooting baskets, bicycling, dancing, water aerobics, swimming, and jumping ropes. Helpful chores include washing the car, washing the windows and floors, gardening, raking leaves, shoveling snow, and walking up and down stairs. Take a deep breath. Slow meditative breathing relaxes the body, causing it to produce more nitric oxide and fewer stress hormones. Nitric oxide opens up the blood vessels, thereby reducing your blood pressure. Stress hormones alleviate renin, a kidney enzyme linked to high blood pressure. Take at least 5 minutes in the morning and 5 minutes to focus on inhaling deeply, taking deep belly breaths each time. For an even more pronounced effect on the blood pressure, consider learning formal meditations, doing yoga, or trying Tai Chi. Reduce the number of hours you spend working. Working over 40 hours per week increases your risk of developing high blood pressure. If you need to quickly lower your blood pressure, you should try shaving off a little time from your work schedule when possible. This is especially significant if your job is notably hectic or stressful. Stress hormones cause your blood vessels to constrict, which only makes it harder for your heart to pump blood through them. As a result, your blood pressure rises. Listen to music. Listening to soothing music for 30 minutes daily can help drop blood pressure, especially if done in conjunction with deep breathing techniques and hypertension medications. Choose soothing music like classical or Indian music. After as little as 1 week, your systolic reading can drop. Quit smoking. Nicotine is one culprit behind high blood pressure. If you smoke or are around people who smoke, cutting this from your life is one way to quickly drop your blood pressure. Smoking increases your blood pressure up to an hour after you smoke. If you smoke continually, your blood pressure will be continually elevated. The same effect applies to people who are continually around smokers. Now, I discuss the third method, that is taking medication. Taking coenzyme Q10 supplement. Coenzyme Q10 supplement is a natural supplement, an antioxidant that has the ability to reduce blood pressure by 17 mmHg systolic over 10 mmHg diastolic when taken regularly. The supplements dilate your blood vessels, making it easier for the heart to pump blood through them. Ask your doctor about the supplement. He or she may recommend that you take a 60 to 100 mg coenzyme Q10 supplement up to 3 times daily. Ask about diuretics. Diuretics flush excess sodium and water out of the body. Since sodium is a known culprit of high blood pressure, the removal of excess sodium can cause a significant drop in blood pressure. Consider beta blockers. Beta blocker causes the heart rate to drop. As a result, the heart pumps out less blood, thereby lowering your blood pressure. Try ACE inhibitors. ACE stands for angiotensin converting enzyme. This enzyme causes your body to produce angiotensin, a chemical responsible for constricting the arteries throughout the body. An ACE inhibitor causes your blood vessels to open, making it easier for blood to flow through them and causing your blood pressure to drop. Learn about angiotensin II receptors blockers. This medication directly blocks the effect of angiotensin, which is responsible for causing the arteries to constrict. Angiotensin needs to join with a receptor in order to affect the blood vessel. These medications block the receptors, thereby preventing the chemical from having an impact. Inquire about calcium channel blockers. Calcium channel blockers work by blocking calcium from entering the heart and arteries. Calcium causes smooth muscle cells in these areas to become hard, which means that the heart must use more force to pump blood through the arteries. This medication relaxes narrow blood vessels, thereby lowering blood pressure. Find about alpha blockers. Alpha blockers reduces resistance in the arteries. As a result, vascular muscle relax, making it easier for blood to flow through. Ask about alpha-2 receptor agonist. This medication reduces the function of the sympathetic part of the involent nervous system. This means that the less adrenaline is produced. Adrenaline, along with the other stress hormones, cause blood vessels to constrict. Take a combined alpha-beta blocker. These are the first line of defense for the patients facing crucially high blood pressure and drop blood pressure quickly than most other medications. This medication reduces the resistance put up by your arteries and causing your heart rate to drop. Learn about central agonists. These medications prevent your blood vessels from contracting quite as easily, thereby making it easier for your blood to flow through them. Note that the effect is similar to that accomplished by alpha-beta blockers. Find out about peripheral adrenergic inhibitors. The brain is primary target of this group of medication. Neurotransmitters responsible for telling the smooth muscles of your heart and blood vessels are blocked when taking these medications. So the message telling those blood vessels to constrict never reaches its destination. Take a blood vessel dilator or vasodilator. These medications only cause the blood vessel muscles to relax. As a result, they dilate, allowing blood to flow through with less pressure.